name's Nick Dash. I'm an optometrist from the UK, and I've been fortunate enough to be awarded the Dry Eye Practitioner of the Year for 2018. And I work within a multidisciplinary setting which has ophthalmologists and optometrists, and my remit is to do with dry and medical contact lenses. So within the practice we have two units which you would perhaps call IPL units, and the one that really we found the most beneficial is the IRPL, which has a pulse signature in terms of the laser, the red light pulsing, and this seems to have some long-term benefits, and we're seeing those long-term benefits 6 to 12 months after the treatments. Whereas with the other more standard IPL treatment we have within practice, we get an immediate improvement, but then that somewhat improved scenario diminishes over the course of months. So the IRPL seems to offer an improved way of maintaining the meibomian gland function and really resetting its ability to produce the oils within the tears. So within the practice we see a range of different patients. There's patients with effectively just dry eyes, but we also see patients that are having juice dry eye through surgery, and we use this technique to really treat dry eye patients pre and post surgery. We also have a glaucoma specialist, and we actually do realize that by treating some of the conditions of the eyes we can induce dry eye. And so we use IRPL as a technology to really improve our surgery, but also those post-surgical outcomes. The treatment we specify as being a course of 4 treatments. It is something that we're getting a small improvement after the first treatment, which is accelerated and stabilized with the second, third, and fourth treatment. Some patients don't need all 4, but we actually program them in for a 3 to 4 period session treatment, and this is over the course of a couple of months. So on the day of the first treatment, being day 0, we would then treat again 14 to 15 days after that, and then 45 days after the original treatment, and day 75 as being the fourth and final. It's not a single treatment, and we do book patients in, and it seems to be quite time sensitive and critical to be in and around those sorts of dates. Some patients certainly are quite nervous of having some sort of laser treatment because they imagine it like corneal laser surgery, or even men perhaps think of that James Bond movie 007 where we have a laser coming up between the legs, and it's not like that. This is really well tolerated, so it's not something that creates pain. Sometimes we get a little snap, as if a slight flick of the skin in and around the area where we're treating, but there's no pain. In terms of patient satisfaction, it's something that they would sooner have. Certainly it's far more comfortable than any dental work that they've encountered previously. Patient satisfaction is super high with IRPL. We have a satisfaction rating of 89%. That means that 89% of our patients would recommend it to their friends or colleagues. So whilst our objective measures such as tear osmolarity, reduced staining, improved tear film stability, those metrics have improved. To the largest extent, the one metric that I'm most interested in is how happy are the patients. And my patients have found a very high satisfaction rating with IRPL technology.